Okay, now I'm going to demonstrate how to administer eye drops. So the first thing that we're always going to do is wash our hands. We're going to identify and gather our supplies. So we have our medication container, we have our monthly medication record and our parent authorization form, we have gloves, and we have a tissue to blot excess medication. So first we can do our first medication check. So we have on our container that this is Okumycin eye drops, and they are for Joey Doe. We're going to instill 1 drop in the right eye every 4 hours while awake. We compare that to our monthly medication record. This is for Joey Doe, Okumycin eye drops, 1 drop in the right eye, and we're going to administer this at 10 a.m. and 2 p.m. We have our parent authorization form. Jane Doe signed that Joey Doe can have the Okumycin eye drops, instill 1 drop in the right eye every 4 hours while awake for an eye infection post-surgery. Okay, so we have done our first check. We're going to read the label for any special instructions. We're going to check our expiration date, and this medication's not expired. And you can ask an assistant to help you position Joey if you think that that's necessary. So we'll do our second medication check. So we have our Okumycin eye drops for Joey Doe. We're going to instill 1 drop in the right eye every 4 hours while awake. Going to double check our medication administration record. And this is for Joey Doe. They're Okumycin eye drops, 1 drop to the right eye, and we're going to administer them at 10 a.m. and 2 p.m. And Jane Doe has signed the parent authorization form for Joey Doe to have the Okumycin eye drops instill 1 drop in the right eye every 4 hours while awake. So we'll administer at 10 a.m. and 2 p.m. for an eye infection. Possible side effects that we could note would be irritation, burning, or stinging. And refrigeration is not required for these. So we are going to take our medication and supplies to Joey so we can explain the procedure. And we are going to position him so that we can instill the eye drops. We're going to put on our gloves. And we're going to do our third medication check. So we have the Okumycin eye drops for Joey Doe. We're going to instill 1 drop in the right eye every 4 hours while awake, which matches our monthly medication record. For Joey Doe, Okumycin eye drops, 1 drop to the right eye, and we're going to administer at 10 a.m. and 2 p.m. And Jane Doe signed the parent authorization form that he can have the Okumycin eye drops, 1 drop, right eye, every 4 hours while awake at 10 a.m. and 2 p.m. for an eye infection post-surgery, and we're going to administer it in the right eye. Okay, so we'll remove the cap off of our medication, and we're going to we're going to pull down the bottom eyelid, and you're going to administer 1 drop into the right eye for Joey by pulling down the eyelid, and you're going to drop the medication right into that pink part of the eye where you pull down, and then you're going to have him do a couple blinks so that the medication is kind of spread out through there. We want to make sure that we don't touch the eyedropper to any part of his eye because that will contaminate your medication container. So you're going to have him close his eyes, and he can use a tissue if a little bit of excess medication drops out. You want to remove your gloves. We're going to wash our hands. I had my pen. I don't know where it went. We're going to document on our medication administration record. I'm going to say that I gave the 2 p.m. dose. So I'm going to just initial right there that I gave that dose. We're going to put the medication back into the storage area, and we're going to throw away our gloves and the old tissue. I'm going to clean my administration area, and we are going to watch Joey for any adverse side effects.